Hi everyone.
Afternoon, everyone.
Hi. I'm just going to pop the agenda in the chat.
Hello, everyone. All a bit quiet.
Hi, Louise. And they're slowly coming in now.
Waiting for anyone to find in. Do you want the agenda on the screen? Oh, sorry, my camera's off.
Oh, hello, Nathan.
Hello, everyone. Yeah, sorry, Naomi, did you want the agenda on the screen at all?
Yes, please, maybe quickly while people are coming in. I've put it in the chat as well, but I might need to add it again because you can see it unless you're already in here. Great, thank you.
I've got this slider, so I'm turning off my camera because I don't know what my face looks like when I can't see it. But yeah, I have everything ready as well.
Brilliant, thank you, Nathan. I don't know if we want to give people a couple of minutes.
Yeah, we had 48. What did I tell you? I was 48, something accepted. So hopefully we should have a number. And I sent a reminder yesterday.
Oh. Right, I can see the numbers going up.
Hi, sorry I'm late.
Hi. Hi.
Seems like a slow start today.
Just wondering if maybe we should kick off. Yeah. I think I can see Bindi.
Bindy's struggling with
Yeah,
IT maybe. Do you want to start then?
Oh, sorry,
Yeah.
I'm here now. I'm here. I am struggling with IT. The microphone on my laptop's not working very well, so I've switched to my phone. So if I appear to be looking in a different direction, I'm looking at my laptop. Hello, everybody. Welcome to this month's Care Provider Network. Do we want to go around and do introductions, or should we just do those as people are speaking? There's 19 of us. Probably do those as people are speaking, I suspect is probably the best way to do it. So we've got a number of items on the agenda today. Workforce survey presentation. We're going to look at digital projects in North Central London, including having a discussion about kind of all things to do with digital. And then we're going to have an update on the vaccination programs that are currently running. I guess that's flu and COVID, and then we'll summarise. So we're hoping to close the meeting by 4 o'clock. I probably should have told you who I am for those that don't know me. I just started talking. I assume naively that everybody knows who I am. So my name's Bindi Nagra. I'm the Director of Health and Adult Social Care at Enfield Council. Okay, so that said, we've got various officers here. Naomi, I think, has been instrumental in organising events. Phil Darby, Richard Elphick, and probably some others I can't see on screen, but they will identify themselves when they speak, and I'll try and get them to, I'll remind them to do so. Okay, if people want to make comments or ask questions as we go through the next hour, you could do that by putting your hands up or making a comment in the chat, or just if you fancy it, just blurt it out. Take yourself off microphone and blurt it out, and we'll try and manage the chaos of that as it happens. Okay, good. Right, so our first item is workforce survey, and we're going to have a presentation, and I think, Naomi, if you introduce yourself and tell us what you're going to do.
Thank you, Bindi. Hi, everybody. I'm Naomi. I'm the Workforce Development Manager, and I'd like to present the results of the survey back to you. Just to also add to what Bindi said, I think we're recording this session just so that people are aware. So I'm just going to share my slides. I'm assuming that you can see them.
Yes, we can see
Yes.
those. Yeah.
Brilliant. Right, so just some general information about the survey. So firstly, thank you so much to everyone who responded. We had such an amazing amount of respondents. We had 159 from the care providers across NCL. Just compared to last year, we had 70. So yeah, it's a fantastic result. The largest response was from home care providers, followed by supported housing, and then older people's residential care homes. Most of the organisations who responded had between 10 to 49 members of staff. The topics that we've looked at include things like recruitment and retention, progression opportunities, overseas recruitment, wellbeing and nursing. So just a bit of a caveat, there are some limitations of the data because we're actually unable to break the results down by setting. And where we've compared this year's data and last year's data, it's not going to be 100% accurate because we've had so many more responses this year. So just to quickly break down the results by borough. So we had a huge response from Enfield, but also I understand that there's a lot of sort of care homes and home care providers in Enfield. But yeah, we had fantastic response from everyone across North Central London. So going on to staff vacancy rates. So as you can see, there's quite a wide variation in the vacancy rates between providers. Interestingly, the top one actually came out at 40 respondents having 0 to 3% vacancy rates. However, there were 28 who had more than 13%. So quite a sort of wide range in there. And just as a comparison, the vacancy rate from Skills for Care is 6.2, which would fit in with this number here of 34 respondents. In terms of challenges for recruiting staff, this actually came up with some of the same results that we had last year. So the top 3 challenges were that there's a small number of applicants, there's a lack of experienced applicants, and candidates are starting but leaving quickly. So we felt that this finding just emphasises the need that we need to do in terms of continuing to promote careers in social care via the work that we do with Proud to Care North London and London ADAS, and also through the upcoming Health and Social Care Academy. In terms of the most difficult roles to fill, unsurprisingly, carers came out top, with senior carers and management roles as well. Interestingly, there were also some challenges around recruiting non-clinical staff. So kitchen staff came up here, a few housekeepers and gardeners. But providers stated generally that they specifically need support with recruitment of the top 3. In terms of recruitment levels, we looked at how this has changed over the last year. And as you can see, there's quite a wide variation in recruitment levels. But it was good to see that actually 39 respondents have said that recruitment's a little higher than usual, and 18 have said it's much higher. In terms of applicant selection, this question was around the use of values-based recruitment. So it was pleasing to see that the majority of providers are continuing to use values-based recruitment, which hopefully demonstrates that people are finding this a useful recruitment tool and a good way to select your applicants. Overseas recruitment was quite interesting in terms of the findings. So we understand that there are a lot of challenges for providers in terms of the process, the application, getting certificates of sponsorship. But actually 20% of our providers are currently recruiting from overseas. And one of them said that although there's limited information available in terms of the process, they've successfully recruited 4 senior care assistants from India and the Philippines. So this is fantastic. So we're hoping by this time next year, if perhaps the process has become easier, we may be able to see a higher rate of our providers being able to recruit from overseas. For valuing staff, we asked how people manage to make sure that their employees are feeling valued. And the highest result that came back here was to ask, acknowledge and act on feedback, followed by support in people's one-to-ones, and then raises, bonuses and incentives. So 82% of providers are currently using exit interviews, which is a fantastic way to look at where people are going, why people might be leaving, and some of the examples we also asked for. So the highest reason for people having left their roles was actually relocation. This was followed by moving to a different organisation, and thirdly, due to issues over pay. But as you can see, there's lots of different reasons why people have left the organisation. Some people have moved into health. Also, quite a few people had retired as well. So there's quite a wide range of reasons. In terms of career progression, this was really interesting and pleasing to see, because actually most providers have stated that they do have options for career progression within their organisations. And as we know, sometimes the social care sector, I think, is perhaps negatively perceived in this area, whereas actually this is clearly challenging the perception that there's no career progression, because pretty much everybody has opportunities within their sector, within their organisation. We also looked at mental wellbeing support, and we asked people to state their confidence for both identifying staff who need help with mental health conditions, but also supporting them to remain in work. And actually 77% of the respondents had a confidence score between 7 to 10, meaning that there is good understanding and awareness of supporting staff who are experiencing mental health problems. This leads us quite nicely on to the Keeping Well NCL hub. So we've compared the data from last year. As I mentioned, it won't be directly comparable due to the different amount of respondents that we've had. So last year, there were 43% of providers who hadn't heard of it. That has gone up slightly this year, but it's probably just likely to more people having responded. But if we look at the 2022 data, and if we combine people using the hub regularly and people using it from time to time, that's actually 40% of providers. So 46% of providers this year weren't aware, but this just shows the amount of work that we need to do with the Keeping Well NCL hub in order to promote their services and make sure that they're meeting your needs. So moving on to health and social care placements, we can see here that actually over 50% of providers will be open to hosting placements, and 20% already have them. For the ones who do have placements, some of the activities the students do includes personal care, admin, sort of activity coordination, support with shopping and befriending. And it was fantastic to see that the providers are really keen to give students insight into the sector and what the realities of actually working in care will be. And hopefully this should help with retention. Just very quickly, CQC understanding, this is a fantastic result saying that 91% of providers have stated that they had a good understanding of how to achieve a good rating. And I know that we had Duncan Patterson from CQC here early in the year, so hopefully that's supported with this response. Just briefly, a few good practice examples. So we asked people for some of the things that they're doing at the moment, and it looks like there's quite a few people who have emphasised how much they are centred around the people that they work with. We've had life stories for residents, and people aim to be as person-centred as possible. One of the providers has also been supporting colleagues to attend skills for care programmes for those looking to develop and prepare for promotion. There was also a mention of high-performing carers progressing to level 5 and being promoted within the organisation, which is obviously helping with retention. And another area of best practice was the use of the sticky people psychometric testing, which I understand has been used as part of recruitment. So just want to go through some of the nursing information as well. So out of the 159 providers, 28 employ nursing staff. We're aware that nursing recruitment is a national issue and is very challenging at the moment. And this was also found within the survey, as 61% of providers have stated that they're having a significant challenge with nurse recruitment. 13% of providers also stated that there's a huge challenge with the retention of nurses. And just want to flag that, recruitment of nursing is a big priority for NCL. In terms of the recruitment and retention of nurses, so there's a few different ways that people are looking to increase this. So 60% of providers are interested in exploring career development opportunities to support recruitment and retention. 52% are interested in exploring nurse apprenticeships, and 50% are offering part-time and flexible roles. So in terms of nursing associates and training, only 21% of the respondents have nursing associate pathways in place, and 45% haven't considered it. With regards to the training that people want for nursing staff, people would like to have nurse educators to support with training and staff development, and also to support with the management development of nurses. So that's all of the findings that we're presenting today. But in terms of next steps, obviously we wanted to provide this back to the group, and again say thank you for responding. All of the results really influence the work that we're doing moving forwards and the workforce plans that we have in place. We feel that the plans for the Health and Social Care Academy will also support recruitment across the sector. We will continue to promote Proud to Care North London as a really good resource for social care, and we're still working alongside the Prince's Trust on youth recruitment into social care.
Thank you.
That's everything from me. I don't know if there are any questions.
Any questions from anybody?
If there aren't now, I'm happy to put my email in the chat, and if anyone thinks of anything, then they can email me afterwards.
Yeah, it doesn't look like it at the moment, but you're getting thumbs up and great response. So, and if people want to speak to Naomi directly, then please feel free to do so. Would you be able to circulate a copy of the slides, Naomi?
Yes, of course. We'll send it out after the meeting.
Okay. I think that's really good, and obviously we do need to think about how some of these actions can be fed into our work programme for the forthcoming year. I was particularly interested in things like student placements from colleges and higher education schools, for example. I think that's a good route, but there's quite a lot that probably we need to pick up in that and take forward. Everywhere I go at the moment, whether it be providers, council, all public sector, voluntary sector, recruitment is the topic that everybody wants to talk about. So none of these responses surprise me. It would be nice to work in a world where we're talking about the quality of candidates, not just getting any candidates. But maybe maybe go back 20 years. but you need high unemployment for that, don't you? So there are downsides as well. Yeah, we're going to send the slides, Daisha, so that will be done. Okay, let's move on to our next. I'm just conscious that we've only got an hour today, so let's move on to our next item, which is digital projects in North Central London. And is it you, Richard, that's going to?
I'll kick off, and then Louise will do the main body of the slides, and Louise has done most of the work on this. So just to say that at the start.
You just introduce yourself, Richard, so everybody knows.
Yeah, I will do. So I'm Richard Taylor Elphick, Programme Director for North London Council's joint work, and we do stuff about our integration with health, the adult social care market, and children's services within our programmes. And Nathan, do we have a copy of the slides?
I don't
I don't think
I
Nathan
do.
has them, but I've got them.
Okay, can you? So just to
Get them up.
kind of, I'll start, and the slides will come up shortly. So we've had a real focus with with our NHS colleagues around digital and with care providers over the last 3 or 4 years, probably really sped up because of the pandemic and how we responded to the pandemic. And we know that care providers actually have lots of innovative use of digital and tech, and often it's actually us as the kind of commissioners and that have to learn from care providers, and that's definitely well we'll share what we've done. We also want to learn what you're using or what you're doing really well to help sort of spread it across the system. So the presentation today will give a kind of update on progress, where Louise will talk through more of the detail, and I'll pick out a few key achievements we've made so far. While this talks about the care home programme, I think that's partly due to what's been possible through funding we've had from NHS England, and our aspirations are to do more with wider care providers as well as care homes. There are definitely some examples in supported housing, extra care, and so forth that have happened so far, and hopefully more to come. So really interested to know from both from care homes what else should we be doing, but from other parts of the sector, what would your priorities be? And we definitely want to learn more about what tech people have and are using currently that's making a real difference to your residents, so that one of our opportunities has been to lever in quite a lot of funding over the last year or two. And if we know there are things that you think would make a real difference, if we can kind of identify those, we can start working those up as possible business cases. So they're the kind of key purposes I want to get out of today. If we go on to the next slide, please. And this really, it just sort of sets out some of our key aims. And I think the really critical one is we want to understand how we can use digital and tech alongside our workforce, not to replace workers, but to supplant what they can do and to help them do more, and work with people in a more proactive way, in a safer way that promotes better outcomes. So we've tended to see any digital project as a workforce project at heart, because it's about how kind of staff have confidence with residents about using tech differently. Next slide, please, I think. And just to give people a kind of reminder of some of the kind of key areas that we've worked on together. So a couple of years ago, I say, as part of the response to the pandemic, we provided lots of laptops and devices, and we know that some care providers already were doing that. So we added where we could, and also kind of help providers link these up with health services, so to make sure people could access virtual consultations and support particularly early in the pandemic. That was a real issue, and importantly, we were really focused on providing devices that enabled residents to talk to their families and addressing isolation and being something that homes or providers could use with residents, so that it wasn't just purely kind of helping us helping us get people to have kind of conversations with health staff. It became a tool in homes about addressing isolation. We did a baseline survey to understand where providers in North Central London were in terms of digital capability that we could use to secure more funding, a bit like the workforce survey Naomi just mentioned, and we'll talk more about that. Louise will talk more about that in the slides. We've supported care providers around evidencing the IG compliance, and now I think the 90% is probably care homes. That figure was something around 10 or 15% a year to 18 months ago. And while kind of IG compliance is a little bit dry, it is also incredibly important to give us the basis for sharing information in the ways that we'd like and for joining up care around residents. And I think we'll help all of those providers evidence in sort of CQC assessments the work you're doing around being well led. So I hope that proves really helpful. And I think I've left the most impressive project to last, which is the WISAN work, where over 100 care providers are using WISAN blue boxes to monitor residents' vital signs, to address if you have concerns about a resident deteriorating, or to kind of understand where a resident's baseline is. So both proactively and reactively. And Louise will say more about that, but there's now, I think, over 4,000 residents being monitored in North Central London regularly, and therefore being able to access care earlier where it's needed, and approaching 5,000 staff have been trained. So it's a real significant change and a really impressive project across care providers, health services and social care in changing kind of how and what we deliver. And I wanted to thank care providers who've embedded that in the way you work, because it is making a real difference to our residents. Louise, I think they're my bits. So if you wanted to introduce yourself and then you talk through the detail and much of what you've done.
Yeah, thanks, Richard. So my name's Louise Keane. For those who don't know me, I'm the nurse educator lead for North Central London. And it was the team of nurses that works with me that has embedded WISAN into the care settings across North Central London. And the same team, along with a few new faces, that will be embedding the technology that we'll be using for falls. We're able to talk about that a little bit later. So if whoever's got in charge of the slides, if you could dip on to the next one, that would be great. So this is basically the structure of the program and what it looks like. And obviously, we have to do some digital maturity and mapping, and that basically means it's where everybody is related to their IT that they've got, thinking about, do you have good Wi-Fi? You know, do you have laptops that work? Do you have laptops that you're able to see people and you're able to have conversations? And we've got a team that works with us very closely who helps us with that mapping and looking at that. And then our projects that we're covering are WISAN, which Richard's talked about, which we'll talk a little bit more about in a moment, which is happening now and has been for the past year and a half, and is it getting embedded. The DSPT toolkits, which Richard also touched on as well. As he said, sometimes that can be dry, but it's really important that we're all looking after each other's data. And we've done amazingly well in North Central London, and providers have really stepped up and done this piece of work that can be quite dry and quite complex, that we've got amazing results now. We're also doing a bit of work around proxy access. So that's when you want to access people's medicines via the GP system through the NHS system. We've put that on pause at the moment because we're just waiting on a pharmacist coming into post in the team who's able to run with that. So we know there's lots of people who've started this, but we have to follow the NHS England's process, and that's related to IG. And a few people have been working with their GPs and maybe haven't followed all of that. So that's why we're bringing someone in so we can just go back with a few providers on that. And then we're about to start a piece of work around falls prevention around our acoustic monitoring. That's just about to come on board. And then our digital social care records, which is in planning, which we'll discuss a little bit more about. So if we go on to the next one. This is really just to give you a bit of an overview for the projects. So I'll start with WASAN. For those of you who don't know, it's a blue box. And inside the blue box is a thermometer, a blood pressure machine, and an oximeter to take some oxygen. And what it's got, a tablet, and basically what happens, the team train the staff to be able to use this, and it's uploaded automatically via Bluetooth. And anyone can download it from a portal. That could be the GP, that can be a consultant, your tissue viability nurse, anybody within the system that we can give access to who has obviously completed their due diligence related to IG. So it's not just the care homes we asked to do this. And we get a News 2, we got a News 2 score. And now the News 2 score is a common language that runs between the NHS and social care. And basically what it tells people is how unwell or well someone is. And London Ambulance Service respond on News 2 scores. So when they've got a News 2 score, you automatically go into the system on that News 2 score, and you're decided who the ambulance goes to next on that. And we're seeing people who've got the WASAN kit and who are using News 2 that they're getting London Ambulance Service to come to the homes much quicker. So we're seeing a reduction in that, which has been really helpful for staff. And as I say, we haven't updated it here, but we're in over 100 homes at the moment, with 50 homes at the minute we're training, and we're across all areas. So we're in extra care, we're in home care, we're in learning disabilities and mental health. And of all of those, something has risen to the top that has made a difference for either the staff and the residents. One of the interesting ones around extra care is that we've saved money to our service users who sit in extra care, because they're not having to jump in cabs to go and see their GPs, because the GPs are able to have a conversation over the phone with them and decide what to do next. So I've got lots of service users who sit there who are delighted that they've got more money in their pockets at the minute. So that's great news. And I think as well is that what we're seeing is that WASAN is really helping with staff. So we're encouraging staff to know their numbers, so understanding their own blood pressure. And we've had to blue light via ambulance several members of staff into hospital recently because their blood pressures, and also we've had to make sure that they're calling GPs and going to see GPs. And this links in quite nicely with the work that Naomi talked about earlier related to the wellbeing hub, etc., because we're able to link them in with physical health related to WASAN. We do encourage providers, if someone turns up at work and says they're not so well, to actually use the WASAN kit for their staff and check how they are, because that really helps, and it embeds everyone knowing what they should be, how they should be feeling. Then our next bit's around DSPT, and that is where we are making sure that everybody's filling in the toolkit and that people are looking after data, and that the data flow is being well looked after, and that your staff understand how to look after data. The acoustic monitoring is just about to come on board, and it's a pilot. We're going to be implementing some technology into 10 to 15 homes across North Central London. Those homes have been chosen on the back of data that's been pulled related to the level of falls that people have had. And what we're going to do is that we've got a team that's come in. So we're going to go into 15 different homes. We're going to go into 5 where we're going to just put the acoustic monitoring kit into. We're going to go into 5 that we're going to give the acoustic kit and the team, which is a pharmacist, a nurse and a physio. And we're going to have 5 that we're just going to put in the team. And after 6 months, we're going to have a look and review to see where we are, to see what differences we see. And then all of them will be offered what they don't have if they would like to have that. The hope is that the acoustic monitoring will enable us to pick up people who potentially may fall. It'll go into everybody's bedrooms and we'll pick them up early and we'll be able to support them. And the team that sits around them will be able to do some work alongside the services that you already have in supporting your homes. And then the last one is around the digital social care records. We've got funding. And that's to increase the number of providers who use their digital social care records. And we're just about to do a piece of work to work out who's using what works, what doesn't work, and who needs some help with that and who's interested. Next slide. So this is just our project timelines. I'm aware against my time, so I better not go on, but you can just see here, those of you who likes visions, that you're able to see where we are on that. Next slide. And then these are the key priorities that we have for the programme going forward, the digital programme. That's about your digital maturity, making sure that everybody can get access and we understand where everybody is digitally, and anybody who needs help, we can come out and help them. WASAN to continue to get it into lots of different settings. As I say, we've got a big push from learning disability at the minute who are desperate to get this. We've got an additional 1,800 residents we'd like to be able to get this year by the end of March. We're doing a small pilot we've already done in domiciliary care, but we're keen to do more of that. And we're also just about to employ some digital champions who are managers who are working in adult social care, who will be paid to come on board and work with us. And spread the message and report back to meetings like this, and to come with us when we're asked to go on stages nationally or at awards, etc. The DSPT will continue to work and continue to help all providers with their standards met. And also for next year, communicate what you have to do, because sadly it's just not a one-stop shop. You have to keep doing it because they keep on adding questions every year, but we'll support people to do that. And as I said, the acoustic monitoring that will start, we're hoping this year, digital social care records, that we're just about to start that engagement, and care technologies. We just need to understand what's being piloted across North Central London. And you know what you're seeing is working. One of the examples we're thinking about is the Plan Ahead app, which Naomi can talk about a bit more about if anybody's interested. Next slide. Oh, the digital social care records. That's just it's just your care planning systems that you've got. And NHS England is very keen that 80% of all adult social care CQC registers providers have adapted and have got a digital, have got this in place. However, we know lots of you already have this, and you've got lots of learning, which we're rather hoping you will be able to help us with. But we also know that there's lots of settings that don't have this, and are needing a bit of support to maybe to say that they would like it, and for us to help them to navigate that. But I think for us to help them navigate, we're going to need a lot of help from the people who are on the call at the minute to talk about the systems that they've got and what worked and what didn't work. Next slide. And then this is just basically, we will be doing a digital maturity exercise. That basically means we'll be coming out and we'll be trying to speak to all of you to find out where you are. And that'll be looking at your Wi-Fi status, just looking at all the different settings and trying to find out more about where you are and what you've got and what systems you've got in place and how good they are or not, and what tips and tricks you can give to everybody else. And then what we'll do is we'll use that result to work with providers to see who would like to have those digital records, who's ready to go now, or who needs a bit more time and a bit more support to get to where they want to be. Next slide. There we go.
Brilliant, thank you, Louise. That was really informative, and I liked the fact that the WISAM system was benefiting staff as well as service users. I thought that was a nice kind of additional benefit that perhaps hadn't been anticipated when it was first thought about, and I think that was quite interesting. So if people have questions, there are a couple of things in the chat. Cola was just asking about the work with home care providers. So does all of this stuff apply to home care providers, or are we mainly focusing on the care homes to start with?
So we are doing a bit of work with home care providers. I won't lie that it's much more complex with home care, and that's because of in a care setting you have your staff and you have them in one setting, and they're all there in the home or wherever it might be. In home care, it's much harder to get your staff together and find a room to do the training, etc. And also there's the backfill for the staff to make sure that the providers are able to carry on giving the care to the people that they're out there looking after. So it's been much more complex when we've been in, and we've got lots of learning from that. But we are trying to work with smaller providers again to see if we can try and trial this to see what other learning we've got. But we do know elsewhere in the country they're using it in home care and it's working really well.
Okay. Kula, did you want to add anything or ask anything further?
We've got a few questions as well, Bindi, that I think so we can answer any of the questions, but I think we had a few. Naomi, you've got a kind of engagement plan, haven't you, with providers that we could use now?
Yeah, so we've got the questions for Slido, which I think Nathan is going to get up for us.
Yep, I will get them. There you go. And
oh, this is like an interactive thing, is it?
Yeah. You'll have to bear with us because it's the first time that we've actually used this.
there you go. So you should be able to either scan the QR code, or if you go to a different tab, or if you have a different device, go to slido.com, and the participation number is 107 4280. And you should see a question or be able to answer the question. There you go. It's come up.
So
and
people have a go at this. If can everybody try and have a go and see?
Yeah, I can already see 2 people participating, so you should see that too.
So we know that most providers have digital care records. So we're really interested in your learning about what works well or what doesn't, as we work with some providers, some smaller providers in particular, that don't have them. So that's what we were trying to get at from this question.
There you go. I think, yes, whoever put in the number, I don't think you needed to put the number in that section. I think you're already on the question, so you might be able to do it again.
Yeah. Good ideas coming in.
People are still typing, so let's.
Yes, some really useful ideas. Do you want?
Can I ask a question? I'd be interested to know what the phones mean. Is that have phones or use phones or don't use phones? If anybody's brave enough to tell me, that I'd be really interested in what that means. I've got the rest, but I was just interested.
That was me.
Ah.
And all of that was typed as one sentence, and it didn't come out as one sentence on that. So it was educate families that staff aren't just texting on their phones; they're using it for care records.
Got you. Thank you.
Because for so long, families are just used to staff shouldn't be on their phones.
Yeah.
But now it's a complete flip of that.
Yeah, good point. Thank you, Andy. Thank you very much.
That's all right. I've no idea why it came out like that. I was like, what's happened here?
Good to have context.
Yeah, definitely.
That's everyone.
Oh,
Yeah, I think that's done, isn't it?
Fantastic. Should we go? There's a couple more questions, aren't there, as well? So we can use that one.
Well, that's the question that's come through. But the next question should be live now.
yeah, it's live.
So with this one, we're really aware that that there's loads of innovation that providers are using, and we don't always, because we don't always know all about that. So we're really interested in are there things that you're seeing that are making a difference for your residents, that we could have a look at that and potentially try and grow across the market. Bindi, I'm always amazed. Your care home in Enfield, the one that you've built as a council, has got some really interesting tech in. So I don't know if you might want to respond to this one as well.
I could try and respond. I'm going to respond verbally because I can't manage the technology at the moment. So one of the things that we're using is, or we're trialing, is a system called Pain Check. So this is an application on a phone which allows us to take pictures of an individual, and using an algorithm, it can assess whether somebody who's maybe non-verbal, somebody with dementia, whether they're experiencing pain. So it's been used in other countries quite successfully. So it's something that we're trialing in our care home for kind of 6 months or so, just to see what the benefits are, which I think is quite interesting, especially if you've got people with dementia whose behaviour may be changing. It may be the result of pain, and apparently by imaging their face, you can actually determine whether it's pain or whether it's something else that's going on with them, which is called Pain Check if people want to look it up. And obviously when we've got the results, we'll happily come back and talk to people about it.
Yeah, that sounds really interesting. Some good stuff coming in here. I'd love to know further about the interactive floors. I'm not sure whether we would have time today. And the magic table, I haven't heard of that.
Yeah, we've got one of them. I think if it's the same, it's one of the magic tables. So it shines images onto a table which service users can interact with. So, for example, you could put balls on a table. They're light balls, and if people go to touch them, they move around, or it could be leaves, or there's all sorts of images you can put on the table. And people can, I think it's a similar sort of thing, that people can interact with them. And you often find people with dementia who are not engaging with the world. You'll put the images on a table, and all of a sudden they're kind of grabbing at things and playing with whatever the image is, which is quite nice.
Yeah.
You need to get out and see some of them in action, Naomi.
Yeah, I'd love to.
They're really, I mean, they would make you want to play with them.
the Covenant homes in Camden, I'm the one I put down the magic table, and I did play with them. They're great fun, but they're really interactive for the residents as well. It's just fantastic to see.
Yeah, I'm gonna probably invite myself to some homes and go and see one.
What's eye gaze?
I think it's probably some.
I haven't heard of that. I'll have to Google it.
I'm assuming it's something that people can use just with their eyes. I don't know if
Yeah,
it's an app.
correct. Yeah, eye tracking software to enable people to communicate who otherwise immobile. So,
Wow.
service users with profound and multiple learning disabilities, we tend to use that with them.
Oh, great. Oh, thank you for sharing that. That sounds amazing.
It's very good. The trick with those people is just finding the way to communicate with them. At first glance, you think, oh, this is just impossible. There's no point, give up. Actually, no. There's people who have gone on to write books very famously. Once you've worked out how to communicate, they've actually gone on to write books. Can you believe that? When previously they could have just been written off as non-verbal, just forget it, you know. It's incredible technology.
How long have you had it?
Well, the technology's sort of developed a few years at least. I think, yes, a few years we've had it. So it's not really brand new actually, but still, I think still quite innovative.
Wow, no, but you must have seen amazing results then in those years. Oh gosh, we need to just have a session just on this so we can listen to that. I'd love to know more.
Yeah, me too.
It's been around a long time, but it tended to be reserved for you know, people with profound physical disabilities as opposed to people with learning disabilities, and it would enable people with physical disabilities, you know, to engage in the world, close curtain, turn on and off lights, manage computers, television. So it's been around for decades, but it's become a lot more accessible.
That's amazing. I've heard of it, but I've just never seen it in practice.
So some fantastic examples here. And Naomi, maybe as you might want to follow up with people around that innovation.
Yeah, definitely.
Piece, and we can think about if there's ones we want to kind of really encourage for more to grow elsewhere.
Could I ask a question? I just wondered if there was something people really wanted to do, but they didn't have the money to do it. I always wonder this, that you've seen a bit of tech and you just think, God, I wish I could get my hands on that. I just wondered if anybody put it in the chat, anybody's seen anything.
I wondered, is that our last question?
Yeah. Is that our last one?
There is one more.
Kind of. I think the way you put it, Louise, was probably better.
Well, if people want to ask.
Yeah, so I think it'd be great to hear if there's things that you really think we should have a look at. Obviously, the last answers we'll take away and we'll have a look at. There was a question about why we've not done as much in dom care, and it's been partly because what nationally we've been able to win funding for, and this has all been through winning funding, has been really focused around care homes. But there's a few signs that nationally they're more open now to thinking about wider care settings, and some of Louise's examples where she's gone well beyond care homes has actually helped to move their position, I think. So really keen to hear what you think would help in other settings as well.
I suppose while you're busy typing, everybody, we are in learning disabilities. We're in 2 young men's homes, and we've trained up their mums and dads to take observations. And the reason that we're in these 2 young gentlemen's homes is that COVID was very difficult for them. And they obviously everything stopped during COVID and they weren't able to go to day services that they were going in clubs and things. And mum and dad took over the care full time. That's really affected mum and dad's physical health as well. And there was some concerns about the young boys' physical health too. Putting the Wazan kit into these individuals' homes has made the parents feel much less anxious and have much more control, which has been great. But also, the two young men had never allowed a full set of observations to be taken. But because they see mum and dad having their observations taken, they've agreed to it. And now we've got a full set of observations, and which the parents do monthly, sometimes more often if they're worried. But the key being is that the two young men are accepting it. And we're hopeful. One of them took the kit on holiday with them to France to make sure they had it with them. So I think there's something about, there's lots of people out there that would really benefit, not only the individual who's living with whatever they're living with, but also the family members.
So not as many ideas coming up this time, but maybe the ones from the last one. Are part of what we can use, and maybe we need to do a bit more deep dives for providers that are using some of the tech already to see what we can learn and spread.
Okay, shall we move on then from that? I mean that was really fascinating, and I think, yeah, opportunities. I mean, I think the interesting thing about money and this area of work is that it's not necessarily huge amounts of money, and sometimes it's one-off expenditure. So, you know, I think the more opportunity we have to have ideas ready to go, so that when and if there is money available. And I was wondering, Richard, and this is probably a separate conversation not to have in public, but I wondered, but I'll have it in public because that's the kind of guy I am. But councils have the DFG grant as part of their Better Care Fund. And I think this meets the conditions, because I think some of this equipment that's provided to individuals is being funded, you know, certainly the specialist equipment is being funded from DFG money. And I wonder whether we shouldn't be, as a programme, asking councils to contribute a bit of their DFG money to this area as well. So I've said it in public now, and you know, it will become the truth at some point.
I think from what I understand, they are willing to do that as well, because I've discussed it internally in Camden. And I think there is room in the budget potentially, but obviously that would have to be looked at across NCL as well.
Well, I mean, you know, as one of the councils, I think I'd be prepared to contribute as well. So you potentially got two, and if you've got two, then you've probably got five.
And sway them, yeah.
So I think we just need to bring it to the DASIS group and see if we can't, you know, put together a proposal to steal some of their money for a good cause. Okay, good. All right. Let's move swiftly on. You're going to give us an update on the vaccination program, I guess, Richard. And I have had I think it's my 4th COVID vaccine now, so I'm doing my bit.
Very good. And it's less an update, more just a little bit of sharing, and wanting to hear from providers about your views on how it's going and anything you need. The NHS is leading on vaccinations of care staff and health staff and residents in need this winter. And I'd had a little bit of feedback from London and sources, and just wanted to sort of test some of it out. So people feel there's a really high risk around this winter. We're already seeing increases in COVID levels on hospital wards in particular, and in the community, and around flu. The that you tend to learn about what's likely to happen with flu from what happens in Australia. And Australia had really bad flu winter 6 months ago, so the best guess is flu could be quite bad in the UK this year. What the feedback I was getting from London sources was they think that resident take-up of the vaccine, so kind of people in care homes or over 80s or vulnerable groups that we're supporting is still really high. Generally, you know, there are some gaps and there are absolutely areas to prioritise, but generally pretty much in line with previously. But they feel that health and social care staff take-up looks low at this point in time compared to previous years. So I haven't seen anything locally that says that's the case. So I wanted to kind of test with people how things are going and whether you have the kind of support you need or anything that you think is missing that would help. And it's really just an opportunity in the remaining minutes we have just to share any views on where we are. And we can take as long or as little time as people want. So really interested to kind of hear from providers how you think things are going. No one jumping at the moment.
No, I mean, I guess for me as both a commissioner and provider, is there going to be any expectation about kind of recording of people's vaccination status again? Are we going to go down around that loop? And I wonder if the government might be asking for data, by the end of November. And if they are, do we need to do something locally to just prepare ourselves for that?
But I think care providers are being asked to report on capacity tracker.
Right.
If you're CQC registered. But it isn't with any, so it's absolutely nothing to do with mandation. That's no longer on the table, which I think we're pretty relieved about overall. But yeah, that's the place to report. I suppose as just a last kind of option is if people do think there's anything that would help that isn't happening this year, then let me know, because I can catch up with the vaccination team and bring up any issues. So if there's anything that you think would help.
Well, I think one of the things, sorry, I'll just, one of the things that we might explore with our NHS colleagues is, I know this isn't the kind of the height of pandemic arrangements, but one of the things that I think worked quite well was the ability to make a payment to care staff to take time off to go and get their vaccinations. Whether it be cost of travel or just an hour out of their day, and I wondered whether we shouldn't be talking to NHS colleagues in the centre about is there an option of being able to pay people some money, individual staff to go and get their vaccines, whether it be flu or COVID or both. So just a thought. We might hit a brick wall, but it did have some success, I think, during the heat of the pandemic, being able to do that. Otherwise, certainly in home care, people are kind of expected to go and get their vaccines in their own time. And, if you don't have a lot of time and you don't have a lot of money, that can be quite a challenge for people. I mean, it's, in nursing homes and care homes where potentially vaccinators can come to the homes and do staff at the same time as residents, that's slightly different. But in home care, I think it's a much more of a challenge to get staff to you know, make the appointments, then take the time, pay for the travel, and you know, whatever else to go and do it. So it's just a thought.
Yeah, no, I will ask about that again. I have asked if the queue jump system, where if you're health and social care staff, you go to the front of the queue, is still in place. So I'm still waiting on that as well.
Yeah, all those little things, I think. Okay, I'm conscious of time, so I'm going to give a call for any other business or anything people want to raise for future items. Okay, so obviously if people would like things that they would like to discuss at future items, then get in touch with Naomi. Graham.
Yeah, sorry, this might be too long a question to ask right at the end when everyone's anxious to go. Mask wearing. It's coming up in our settings. It's basically still mandatory. I think the gov.uk guidance is all care workers should be wearing face masks. But getting increasing pressure from staff, you know, come on, when's this going to end? Occasionally they're not 100% compliant with the rule. We've taken some people through disciplinary, for example. And then this rumour came around recently. The NHS is planning on dropping the requirement for their staff to wear masks. So, is anyone not wearing masks, or are we still carrying on as we were?
I think our local, we can double check the local public health advice, but I think it is that people should be wearing masks, and I certainly haven't heard of any change on the NHS side. But happy to go away and double check on that and send a note out.
Yeah,
Sorry. What they might have heard is that about a month ago in the NHS they did drop mask wearing in non-patient facing areas, but they're all back wearing them again. So there was a window. So some of your staff might have heard about that. So non-patient facing, they weren't wearing masks. So offices, etc. But anything patient facing, so any clinics, walking in corridors, you had to wear masks, but it was for a very short window and then it was put back on again.
Okay, thank you. Yeah, no, I think that's I thought that's what people were going to say. I don't know if anyone out there is brave enough to say that they've dropped it altogether.
No, they didn't. But that's what they did just for a period of time. So your staff might have been told that because lots of carers speak to carers in hospital.
Sure. Yeah. No, thank you. Yeah, I will feed that back that it's still masks, I'm afraid.
Yeah. Okay. Unless there's anything else, I'm going to bring this meeting to a close. Thank everybody, the presenters, everybody for engaging in the kind of questions and answer thing digitally, which was very exciting. And wish you all a nice week.
Thank you very much, everyone.
Take care, everybody.
Thank you. Take care.
Thank you, everyone. Have a good day.
Bye.
Thank you. Bye. Bye.
Thank you. Bye.